So I think for me, from my perspective, because I've been involved in the conference now, I started off as a delegate and have sort of come through the ranks onto the committee. But what I liked about it was the sort of sense of belonging at the conference, and the excitement and the buzz of networking around student education. I think the fact that you have a group of people there who are really passionate and committed to student education, healthcare education.
I've probably been involved with the conference organising for over 7 years now, and I think ever since I got involved in NET, I see it as a unique conference. The ethos there that surrounds the conference, the NET element of the Healthcare Educators NET conference comes from the word networking, and I think you see an awful lot of networking, a lot of support, a lot of collaboration. And inspiration that people go away with, but I think it's that friendliness which brings people back year on year on year. We know it's challenging times out there, post-pandemic, ageing populations, economic challenges. We know the healthcare sector itself is really challenged and has been challenged over the last couple of years, and so is the higher education sector. So the conference this year is about the reality of that.
That compassionate education, compassionate leadership is really important, because I'm really mindful of we are educating future healthcare professionals, and sort of compassion, person-centered care should be central to everything that they do. But then it does make us step back and think, actually, do we role model that as well? So I think that theme for the conference is really important. I think that's the beauty and the growth of this conference, because when I first was a first delegate, it was predominantly nursing and midwifery. So me as a radiography delegate, I felt a little bit of an interloper, but the fact that it's grown over the years, I think is really, really encouraging, but also really important. Andy mentioned earlier on about the fact that, one of the challenges we have in healthcare is the fact we've got an ageing population, and, and those patients are going to be seeing a number of different healthcare professionals. So the fact that our conference is reflecting that kind of journey and that multidisciplinary approach to healthcare, I think is really important and really key.
I'm a registered nurse by background, so there is still a strong nursing focus there, and I learn a lot every time I'm at conference. But I think if you think about interprofessional education, how we promote it and how that is really valued by students, it's the same when it comes to an interprofessional conference. We've got midwifery, ODP, operating department practitioners, that is social work, medics, radiographers, physios, occupational therapists, podiatrists, paramedicine, veterinary medicine, to name not every professional discipline. We get lots of delegates talking about how they felt supported, how warm and friendly the conference was, but actually how they've learned an awful lot and how they've been inspired, and they're going to go away and utilise some of what they've learned in their own practice to make a real difference.
I think for me as well is the fact that you go away and you're thinking, oh my gosh, my head is just buzzing with all these ideas. It's almost like I don't know where to start because there's just so much kind of good practice. And it's really, as I said earlier, it's just so encouraging that you've got all of these people involved in healthcare student education who are just so passionate about what they do.